This is episode 3 of FACT's educational video series leading up to World Cord Blood Day on November 15th. My name is Klamer and I am the director of the Sydney Cord Blood Bank, one of 3 facilities that make up the public cord blood banking network in Australia known as AusCord. I'm here to tell you how FACT compliance and re-accreditation readiness protected and prepared the cord blood bank from many of the impacts and risks associated with the COVID-19 pandemic. According to the World Marrow Donor Association, there was a greater than 50% reduction in cord blood collections recorded globally throughout the pandemic. Whilst Australia was reporting relatively low case numbers compared to the rest of the world, cord blood banking activity was still greatly diminished. For example, the Sydney Cord Blood Bank ceased collections for a total of 7.5 months out of the previous 20 months. Fortunately, collections did not cease for longer than 6 months, which would have triggered a number of requirements under Section B12 of the 7th edition standards. These would have included renewal of collection site agreements and retraining of all collection and processing staff. The FACT standards prepared the cord blood bank primarily through the requirements for emergency, contingency, disaster, and safety plans designed to protect both the quality and efficacy of cord blood units, but also the safety of staff. Whilst a disaster plan may include the large institution's disaster plan, the cord blood bank must address specifically the needs of the cord blood bank. The disaster plan may include key personnel that must be contacted, a flowchart for maintaining operations if possible, and a plan may include the SOPs related to supplies and/or collected samples in the event of an evacuation. Written plans for alternative transportation or shipping in an emergency should be included, which was most relevant during significant challenges and interruptions with international and domestic air transport services. Lastly, installation, qualification, validation, and ongoing maintenance and calibration of a continuously running environmental monitoring system with automated callouts was critical in allowing staff to adhere to strict lockdown measures to protect themselves, the community, the patients, and the delivery of clinical care at the hospital where the cord blood bank is situated. The standards provide a very clear roadmap of how to manage change and give guidance on what to consider for every process undertaken. To learn more about these specific standards and how FACT accreditation can protect your facility from unforeseen risks, tune in to the World Cord Blood Day session hosted by the Save the Cord Foundation. To register, please visit worldcordbloodday.org.